WCNC Charlotte. This is Flashpoint, where power and politics collide and the tough questions get asked and answered.
Thanks for joining us here on Flashpoint. I'm Ben Thompson. North Carolina is seeing a slight increase in new COVID cases. Health officials aren't just watching cases, they're also watching COVID levels in our wastewater. Right now, the state pulls wastewater from 24 different sites, but they're looking at 12 more to give them a better idea, a better view of the entire state. It helps them keep tabs on what's going on in the community, and state officials say it costs effective as well and not as invasive as testing. And here's the latest data. It shows 12.2 million particles detected statewide. That's more than double than it was 2 weeks ago, but still much less than the 106 million particles detected during the peak of the Omicron surge back in January. Joining us today, Mecklenburg County Health Director, Dr. Raynard Washington. Doc, thanks for coming back on. We appreciate it.
My pleasure.
We know when it comes to COVID cases rising slightly across the state. What are we seeing here at the local level?
Sure. So right now we're seeing a very similar situation here in Mecklenburg County and in this region, where our case counts and our wastewater surveillance are all showing signs of increase. We are seeing some slow impact in the hospital setting, slight uptick in emergency department visits, as well as a slight uptick in inpatient admissions. And so certainly we do see that we're experiencing sort of a spring bump here, and COVID activity is increasing in our community.
We didn't see much of a surge after spring break. Should that encourage folks who are wanting to get out and travel?
Well, I think what we're seeing now is probably a result of the Easter holiday as well as the spring break season. And so certainly I think we encourage folks to continue to use precautions as they're out and about in public settings, particularly as they're traveling to other cities and states and other countries, just to continue to use those precautions that we all know work well. Of course, if you want to stay up to date on your vaccines, as well as use masks when you're in high-risk settings.
I traveled over this past weekend and was at the airport and saw very, very few masks. Do you feel like the mask mandate was lifted a little early?
I believe so. I think, I was at the airport this weekend as well. Unfortunately, I had to go to a funeral in Pittsburgh, and I also wore a mask the entire time, and also saw very few masks around me. But certainly, I do believe the airport continues to be a very busy public setting. As you probably saw, Charlotte's airport in particular is really busy. There are a lot of people. There are lots of foot traffic, and of course, there's a lot of congregating, particularly around the gate areas. And so, I do think it's important for people to continue to recognize that COVID is still with us. It's still here, and it's important for those in our community who are particularly at greater risk for infection to take those additional precautions, including wearing a mask when they're in settings like that.
I saw Deborah Burks, she's doing a media tour right now, and I saw she mentioned that we should expect a summer surge of some type. Do you expect that as well?
Well, I'm not sure yet. So right now, 100% of our sequence specimens continue to be the Omicron variant and its lineage. So certainly as additional subvariants of that particular variant are emerging, it's kind of unclear at this point what the consequence of that will be. Fortunately, we have not, we're not hearing just yet of any new variants of concern, which would certainly give me more caution as it relates to considering that we may have a bump in the summer. I certainly expect, though, that in the fall, we would expect that we would, similar to we have the last several years, we would start to see an uptick in cases similar to what we're seeing right now.
You recommend folks getting boosted. Are we going to just have to keep on getting boosted? Because, I know we say that the boosters sort of lose their effectiveness after several months. Is this just the new normal?
It's a great question, and unfortunately, I don't have an excellent answer for it. The reality is, I think our partners in science are working very hard to ensure that our vaccines are optimized to the types of variants that are circulating currently in the community. They are continuing to study sort of the impact. There are several vaccines that we have to get several doses of. Obviously, the flu vaccine is the most common that people know we get on an annual basis, but there are other vaccines where we have to get, at least 4 or 5 doses before completion completion of the series. And so I don't know exactly what's to come in the future. I don't know what the schedule will look like, but certainly as we are learning more and studies are continuing to push forward, we will continue to keep folks informed as much as possible. As I'm sure you're aware, the FDA and CDC have authorized a fourth dose for adults who are over the age of 50 years old. And so I certainly encourage individuals who are more vulnerable in any way and over the age of 50 to consider getting that dose. And if you have questions, you should certainly reach out to your healthcare provider. And certainly our team is able to answer some of those high-level questions here at the department.
Recently, Anthony Fauci sort of indicated that he thought that we are now entering a new phase of this more endemic. Do you agree with that?
Well, I believe that, the points he made that I certainly agree with is that certainly we have not contained COVID and it's with us. And so I think the reality is that we have to adjust, adapt, and learn to live with it as it stands today. And so that reality does suggest that we are going to transition to more of an endemic phase of the pandemic. And certainly, but that's still to be determined, I believe. The reality is I don't know what types of variants are going to emerge. I don't know what the impact of those variants will be. And so certainly I think we've got to remain cautious. We certainly shouldn't let our guards down. And I think people have so many tools available to them to really help us make sure that as the virus circulates and mutates and changes, that we continue to do everything we can to protect life, protect our healthcare systems, and also at the same time be able to continue to live life. And I think those things, that balance there is really important. But we certainly need people to use the tools that we have available, including tests and masks and vaccinations, to make sure that we can continue forward, getting back to sort of everyday life.
I mean, I assume you probably can't, quantify this in numbers, but understanding how rapidly some of these subvariants of Omicron are spreading, how much virus do you think we have out there in the Charlotte area that we don't even know about because people aren't getting tested and they might not have any symptoms at this point because they've been boosted? And how much virus do you think we have out there?
Well, that's one of the fascinating things I appreciate about the wastewater surveillance system is that it does give us some relative context to how much virus may be circulating. And we are seeing levels that, in terms of the level of viral particles in the wastewater, that are high, but they're not as high as they were when Omicron first began. And so certainly we're not seeing we're also not seeing the type of acceleration in terms of our actual case counts or emergency department visits or the type of growth in hospitalizations that we saw with the initial version of Omicron. And so certainly that gives me a little bit of encouragement that our immunity wall is sort of holding up a little bit, at least for the time being. So certainly, we are seeing elevated levels, but those levels are higher than what they were 2 or 3 weeks ago, but they're not as high as they have been in previous years, and actually nowhere near as high as they've been in previous months. So, certainly I know there's virus circulating, and certainly those who were not impacted by Omicron the first time, certainly are greater risk. Individuals who are not vaccinated, those who are more vulnerable, should really consider taking precautions at this time and making sure, one of the most important things people can do is don't mistake your allergy symptoms or, it's allergy season, there's pollen everywhere. If you feel like you're having some symptoms that are respiratory-like, go ahead and take a test just to be on the safe side and make sure you're taking those precautions because that will help us, again, contain the spread as much as possible in the community.
All right, County Health Director, Dr. Raynard Washington. Doc, thanks for coming on. We appreciate it.
Good to be here.
More Flashpoint after this.